Assalamualaikum student, today my lecture is about DPT Final Year SEQs Voice Notes of Surgery Annual 2015. Are you ready for this? Okay, let's start it. Question number 1. How will you treat a patient with an appendicular mass? Answer is Oschner, Sherren, Regimen, which is record general condition of the patient. Number 2. NPO of the patient. NPO means nothing by mouth, fluid or food. And number 3. Record pulse for only. Number 4 is record temperature for only. Number 5 is give IV fluids to the patient. Number 6 is give antibiotic therapy to the patient. Give antibiotic therapy by follow triple regimen, which is the combination of 3 things. One is proton pump inhibitor. Number 2 metronidazole, and number 3 is clarithromycin. Step number 7 is measure the size of mass. And last one is CT scan. If an abscess is found, then it should be drained under CT guidance. Question number 2. Enlist the causes of post-operative pyrexia. During day 2 to 5, atelectasis of lungs are responding. Atelectasis of lungs are mean partial collapse of lungs. During 3 to 5 days, superficial and deep wound infection are reported. And during 5th day, chest infection, urinary tract infection and thrombophlebitis are reported. Venous blood flow affected superficially to your skin is called thrombophlebitis, but if it affected deeply to your body is called DVT, deep vein thrombosis. After day 5, wound infection, anosmotic leakage, intracavitary collection, abscess, DVT, blood transfusion reaction, wound hematomas are reported. Anosmotic leakage means leakage of luminal content from a surgical joint. Number 3. 55-year-old man presented with history of carcinoma of esophagus. What investigations are needed to manage this disease? Endoscopy is the first line investigation for most patients. Secondly, we perform CT scan of chest, abdomen and pelvis. We also perform endoscopic ultrasound, bronchoscopy, laparoscopy to detect peritoneal disease and PET scan. PET scan is an imaging technique that uses radioactive substances to visualize and measure metabolic process in the body. Bronchoscopes is used to view the airways and check for any abnormalities. Above processes are used to look inside body for medical reason. Laparoscopy means process of examining the content of the abdominal cavity using a specially designed endoscope. Number 5. Define jaundice and how will you classify it? Jaundice is defined as yellow discoloration of skin, sclera and mucous membrane with the pigment bilirubin. Has 3 classifications. Number 1. Prehepatic, due to overproduction of bilirubin. The example of it is hemolytic anemia. Second is intrahepatic, which caused by acute or chronic hepatic insufficiency. First one is post-hepatic, caused by obstruction to flow of bilirubin from liver to duodenum. It is true surgical or obstructive jaundice. Sequence number 6. Name complications of scaphoid fracture. 5 types of complications of scaphoid fracture. Number 1. Avascular necrosis. Number 2. OA. Number 3. Non-union. Number 4. Malunion. And number 5. Delay union. Avascular necrosis means death of bone tissue due to lack of blood supply. Non-union mean body unable to heal fracture, and malunion mean fracture has healed but other than its original place. Delay union mean it is time consuming process due to some reasons. Sequence number 7. Name causes of upper gastrointestinal bleeding, mean GIT bleeding. Answer number 7. Number 1. Ulcer. Number 2. Erosion. Number 3. Mallory Wistier. Number 4. Esophageal varices. Number 5. Tumor. And number 6. Vascular lesion. Ulcers mean open sore on external or internal surface of the body, and erosion mean the process of eroding by wind, water. Mallory syndrome refers to a tear or laceration of the mucous membrane, most commonly at the point where the esophagus and the stomach meet. Foyle's lesion is a medical condition characterized by a large tortuous artery, most commonly in the stomach wall, that erodes and bleeds. SCQ number 8. Name complications of plaster of Paris, mean POP. Answer number 8 is complication of POP. POP has variety of complication. Number 1 due to tight cast, number 2 due to improper application, number 3 allergy, and last one is other. Let's start in detail. Due to tight cast, there are 4 complications. Number 1 pain, number 2 pressure sore, number 3 compartment syndrome, number 4 peripheral nerve injury, and due to improper application, number 1 plastic blister, number 3 breakage, number 4 loose cast due to allergy, number 1 allergic dermatitis, and other is muscle wasting, skin abrasion, laceration. Skin abrasion mean an area damaged by scraping, and laceration mean a deep cut or tear in the skin. Thank you for watching my video. See you in next video. Inshallah. Hafiz.